My name is Charles Ngodo. I'm the Chief Nursing Officer, Medical Hospital. And in this hospital, we provide very many services, including reproductive health services. Yes. There are many challenges that we are facing right now. In terms of infection prevention, it used to be routinely people who are mingling together, and we were not having face masks at that time. We were able to communicate to our patients and clients effectively, and the points used to be driven home. And in terms of even the clientele flow in the clinic, right now it has been really affected because people are in fear of contracting diseases in the hospital. And if you checked on our outpatients, we have also given the 1 meter the distancing that you're trying to give to the clients, meaning there is not even adequate space for the clients to sit, meaning we have to create more space outside for the clients to be able to sit. Currently, our staff have to wear face masks, so we're making it difficult to pass information directly to the client effectively. And in terms of even the commodities and even the supply, it has been halted and even affected by this COVID-19. Sometimes when a client is coming to the health facility and there is a cough and the client has come for a reproductive health services, we have to first routinely ask the questions of history of travel, history of contact with someone who has tested positive, and a sore throat. So we are going deep down asking questions that are not related to reproductive health directly, which is also hindering us in terms of service provision. So basically, we are focused so much on getting more clients who are exhibiting symptoms of COVID-19 rather than reproductive health. It has increased because there is fear of patients who have been going to Mbagathi Hospital and Kenyatta National Hospital for the antenatals. So we are getting overwhelmed by the number of antenatals clients who are coming. But at the end of the day, we still have to ask them the questions that we were not asking previously. It is taking more time, and the clients, in terms of the waiting, it's taking a little bit longer. In the wake of COVID-19, we have all health workers must take precautions when they are asking several questions and screening antenatal mothers in the clinic. We are also encouraging clients who do not necessarily have to come for antenatal clinics not to come to the hospital so that they're not able to contract diseases. We are also spacing the clients in terms of visits. There were times they normally come for the antenatal visits. We are actually really spacing them. And when it comes to the family planning, mothers who are coming for reproductive health, we are giving long-term family planning methods so that they're not able to come to the health facility frequently. But in the week before the COVID-19 that was discovered, there are several things the government needs to do so that you're able to provide, so that you're able to reduce the maternal and child health in our country. I thank the government because it has been able to give accessibility to health facilities in terms of ensuring that there is no payment in the maternity. But more so, they need to also skill the midwives around the globe, around the country, with giving them the EMOC training, the emergency obstetric care training, so that at least all midwives are able to get that kind of care. And also, when it comes to resuscitation of children, that training must be enhanced and must be readily available in government facilities and even in the private sector. For us who are in the private sector, so that you're able to reduce the infant mortality. When it comes to sexual reproduction and rights, accessibility to health services is paramount to each and every individual in the country, regardless of their sexual orientation. So, as a health worker, and as a health worker, I advise the government to make it accessible for people who are sex workers and people who have got other different sexual orientation, the MSMs, men having sex with men, and the lesbians who are coming for services, because they become stigmatized when it comes to them asking for reproductive health services, and even when they come for treatment of any sexual related illness. I think I would also advocate is for access for family planning services to every individual who feels they want to access health services, and make it available to every other person who wants to get it at a given time. We understand the kind of challenge that is happening, and it's actually around the globe that PPEs are not available to health workers. Which is affecting the private sector, it is also affecting the public sector.
I'm a clinical officer by profession. I have been in the healthcare for the last 4 years, and during this time of the pandemic, it's been greatly affected, and especially when I talk about the nurses and the role they play in the healthcare. I think they they have been massively affected, just as other medics and other healthcare workers. And what I can say, how the pandemic has affected our nurses, it has really made most of the nurses to have a lot of fear, and also to reduce the closeness we get to our patients. And for one to manage a patient well, you need to get close to them, and due to the unavailability of personal protective equipment, we have found ourselves in that situation of at least maintaining a distance even with our clients who might really benefit from us at least getting to examine them very closely, and at least to find out what could be the issue with our clients. So this has been one of the ways in which we have been affected, nurses being the first contact with the patient during triaging of patients. And you find that the challenge we're having with the protective equipment has made it very difficult, and even carrying out the normal clinics like antenatal clinics and the child welfare clinic, we find that we have been restricted. What we have been carrying out as routinely normal, we find that now we have to keep our distance. And this has affected even our client flow. You find that children who need to come to the clinic for weight and for vitamins, they are now having to wait. So we are now attending for emergencies like injectables if it's immunizations. So I think this has affected our nurses. Our nurses play a great role even in carrying out procedures, and they assist us doctors to carry out most of the procedures, the surgical procedures. And I think we really need to put our hand in supporting our nurses so that they can be able to continue to be of help to us. How COVID has affected us, I think it has really affected us in terms of what I have stated about maintaining distance, which has also affected our interaction with our patients, and also how we can support our nurses. I think our nurses, most of them have no job security. You find most of the nurses are struggling. They have not been employed permanently. So they have not been able to secure a job that they will be more secure in it. So you'll find that most of our nurses are struggling and they need to be supported. The government needs to create more opportunities for nurses to enter into our government facilities, because you'll find that most of the nurses in these private sectors, they are really suffering, and it's because the salary could be low, or maybe they are delaying salaries, and they still keep working. They don't lose heart because of lack of salaries or delaying of salaries. And also, you'll find that we also need to support them by training them so that they can be more they can be safe themselves, and they can also provide safety to the clients they're attending to. Like, we need to educate them, especially now that there is that pandemic of COVID-19. We need to educate them on how to protect themselves and how they will protect their clients from like spreading the infection. So they need to be more trained. We need to provide an opportunity even for nurses to be trained. Also, we need to support them even from the community level. Like, the community needs to know that if you have like symptoms of the coronavirus, how you're going to protect even the doctor who is going to attend to you or the nurse who is going to attend to you. Like, if the community is aware of how the virus is being spread, like, one can't come coughing all through and even enter into a triage room and they wait for the nurses to attend to them and to get close to them. And by the time we are asking questions is when now the patient is saying that they have such symptoms. So we need to educate the community on how they are going to protect the doctors or the healthcare workers who are attending to them. And also, we need to work together as a team, the doctors and the nurses, so that we can empower each other, empower the nurses, and they can also empower us by showing, by working together as a team. And also, we need to provide like we need to provide for the nurses like allowances. Some of them are leaving work late and there are no means of going back home. And if we provide such, like we provide a means of transport for them, or maybe we provide housing allowances, maybe they live within the hospital, at least that one is going to relieve them a great deal. So those are some of the things that I can talk about when it comes to supporting our nurses and how they play a very great role in healthcare.